Dr. Richard Di Natale was elected to Federal Parliament in 2010 as the Greens' first Victorian Senator. His portfolios include health, multiculturalism, youth, federalism, gambling and sport. And prior to entering Parliament, he was a general practitioner and also a public health specialist. There's a whole raft of wonderful achievements that he's made on the program there that you can read while he's been in Parliament, and he's the chair of the Senate Select Committee into the Abbott government's budget cuts, and the deputy chair of the Senate Select Committee in health.
Don't worry about
and wonderful things. Please welcome Richard.
Good on you. Thank you. I don't have a PowerPoint today, so you're going to have to look at me, I'm afraid. Thanks for the invitation to my first Mardi Gras. It's been great. I've been to Nimbin a few times, and it's always fun being here. Being a politician and a doctor, I suspect for some of you means I'm the last person that should be talking about this stuff, but I want to talk to you a little bit about my own perspective, how I've come to the issue, and why I think it's an important reform. So, I've always had a very, very strong view that, all drugs have got the potential for harm. I've written lots of scripts for lots of dangerous drugs. I'm taking drugs right now. I've had a couple of coffees. I've got a bad knee, and I've got some Voltaren for my dicky knee. I mean, all drugs have got the potential for harm and for benefit. But the bottom line is that the way we are approaching illicit drugs is that we are creating more harm than we're preventing. We have a range of drug laws in this country that mean that rather than keeping people safe, we are increasing harm, and that's the antithesis of good public policy. So I've always been very, very committed to the issue. It's something that I want to try and change in the federal parliament. We've gone backwards in this area. I was just saying earlier, it was 1999 that we were having a debate about whether we'd have heroin trials rolled out across the country. We had heroin trials lined up, ready to go, very strong popular support. We had every state government in the country behind them. We had the opposition at the time behind them, the opposition leader in Kim Beazley supporting it. And the only reason we don't have heroin trials up and running now is because the Prime Minister at the time, John Howard, decided that they wouldn't happen. In the 1999 state election in my home state of Victoria, there was a opposition at the time, the Labor opposition, went to the election promising to introduce half a dozen safe injecting rooms. They didn't expect to be elected. They were elected, and they basically retreated on that policy because they got a bit of a backlash. So there was a time when we were able to talk about these issues, that we were leading the world in some areas, and I just think we've gone backwards. And one of the things that I've got the opportunity to do in the federal parliament is to try and change the way we talk about illicit drugs. There are lots of areas that I think we do need to change. I mean, you heard about saliva testing, and I've just, again, been talking to a few people about that. Huge issues in regards to that. The sniffer dog campaign, where again we're creating more harm than we're trying to prevent. There's the way we deal with new and emerging synthetic substances. Big issues there, and I've been fighting a lone battle in the federal parliament to have a much more rational approach, something like what's going on in New Zealand in terms of ensuring that people are able to put an application in and demonstrate that something's safe, and if it is safe or of low harm, then it should be made available for use. But it's the issue of medicinal cannabis that I've been most active on at the moment. I want to talk to you a little bit about why I've taken that on and some of the progress that we're making in that area, and I think we're making very good progress. First thing to say is that medicinal cannabis is a very effective treatment for some conditions. The evidence is now very, very clear for chemotherapy. If you've got nausea secondary to chemotherapy as a second-line agent, lots and lots and lots of very, very good studies that demonstrate it's an effective treatment. Some forms of pain, we know it's effective for other conditions like muscle spasms in multiple sclerosis, very, very promising as a treatment for epilepsy that's not been controlled through other drugs. So there's a lot of very good evidence, but I think someone earlier made the point that it's not actually the evidence and the science that drives this debate, it's emotion. And one of the things that's actually happened in the medicinal cannabis debate is that we've had some very strong, high-profile advocates who have captured sort of public imagination. We had the Haslam family, son Lucy Haslam is a nurse. Her husband was a policeman. In fact, I think he worked in the drug unit. Whose son, 20 years old, gets bowel cancer, having intractable nausea after chemotherapy. They're ready to call it quits. Gets introduced to cannabis. Suddenly his nausea is improved and he's able to tolerate his medication. And they became the sort of voice of the campaign. That was an opportunity for me to introduce that story into the federal parliament. We flew Lucy up to the federal parliament. We had a briefing with MPs, and I've got to say, I've had a few of these things. We had the room full of politicians who were interested in listening to Lucy. We had Alex Wodak, who's been a long time advocate in this area, also attend, and we suddenly were able to generate some interest from politicians, including a number of Conservative politicians who were moved by Lucy's story. It also helped that there was one of the grandchildren of a former National Party MP in Queensland who was using medicinal cannabis. And suddenly momentum grew in Queensland amongst the Liberal National Party for reform in the area. And so what I decided to do, and one of the things I've done in the Parliament, because you don't get anything done in that place if you stand up and grandstand and want to run an issue on your own. The only way we're going to get reform across the line here is by working with all parties. So having established a cross-parliamentary group, or at least re-established a group that was active in the former parliament, I've got members from all sides sitting on that group, and we got them involved in the issue, and we got them advocating within their own parties. The next step was to then look at what was going on in the state space, and at a state level there was some movement about potential trials, which for me was always a concern, because the concern I had was that we're going to use trials and potentially delay effective action for a year, 2 years, maybe longer. And so what we decided to do was to draft federal legislation that would effectively say we've got a substance that we know is effective, and we know that people are using it in a completely unregulated way. We don't know what they're getting. There's no quality control in many cases. Why don't we treat this like other medicines? So we put that to the Shadow Health Minister, or I should say the Parliamentary Secretary for Health. And the response we got was, no, the TGA can deal with it. This is an issue that should be dealt with through the existing regulation. And so then got us thinking about, okay, well, why isn't the TGA dealing with it? Theoretically, anyone can put an application into the TGA. The TGA looks at it, says, yep, it's effective for a range of conditions, we'll allow you to sell it for medicinal use in Australia. Of course, there was a few problems there. The first problem is to put an application to the TGA costs you 250 grand. So you're only going to do it if you're a pharmaceutical company or got very deep pockets. The second issue is that you're only going to get a benefit from putting a drug through the TGA process, spending all that money, if you can get some form of patent protection, which is why pharmaceuticals do it, is they get protection, they get the drug, exclusive access of the drug, and they're able to sell it. But this is a natural product. You can't patent what's effectively a natural product, unless you can maybe patent the way you extract it from the plant, the actual process, which one company's done, which then brings you on to the next issue, which is you've got to actually be able to sell it at a price that's competitive with what people can buy it for currently illegally. Like, you're not going to put an application in for a drug if you can't sell it for less than what people can buy it illegally. So we had some big barriers as to why this medicinal cannabis wasn't suited to going through the TGA process. So it was at that point there we looked at all the international experience. How did they deal with this problem? How was it that their regulatory system for dealing with conventional medicines, if you like, how is it that they were able to make medicinal cannabis available in those countries? And we looked at Israel and what Canada was doing, what the Netherlands were doing. And the only way to deal with it is to create a separate regulatory pathway. It's got to be done separately. The TGA is not fit for purpose for this job. So we've effectively drafted legislation that's based on those models that says we're going to set up an independent regulator or office of medicinal cannabis, because this is a unique product. There's no other product that has the illegal status that this has, based on international conventions. It's a natural product. You're not going to be able to make your way through the TGA process. So we set up this independent pathway. And what we've said is this is an independent process that needs to be dealt with outside of the way we deal with normal drugs. We want to set up a panel of experts. We want consumer reps on it. We want people with expertise in pharmacology, health, law enforcement and so on to be part of this regulatory body. We want them to license growers. We want some quality control in the process so that they can license growers and we can make sure what we're getting is what's being prescribed by doctors. We need to know exactly, we need to know that doctors have got the certainty of being able to prescribe something and be able to make and ensure that it's available to people and that they know exactly what they're getting. So the independent regulator would effectively license growers, license the distribution of the product and license prescribers. We've kept it very general. We don't want to be too prescriptive. We think it's up to the expert body, not up to politicians to decide what the parameters need to be. But what we do know is that you're not going to get anywhere if you just leave it through the existing regulatory pathways. We're going to do it through the TGA, separate from the TGA process. Look, one of the great things about it is that it's actually has a lot of momentum behind it now. Once you had those stories, not just from the Haslam family, I think there might be someone from Geelong here whose family have been very strong advocates. We've had people from right around the country who, for example, a lady giving her child who had intractable epilepsy, giving her child a tincture, then being raided by the police, and then after that, being visited by the Department of Human Services to have her fitness as a parent questioned. This is a mum of 5 kids. Her young kids taking the medicinal cannabis and it's completely turned their life around, and yet we're treating them as criminals. Now that story was again broadcast on a mainstream current affairs program, and suddenly we've got the media behind us, as opposed to in this space where we have often the mainstream commercial media being very critical of any moves towards drug law reform. So we've got a combination of factors going on at the moment where we've got politicians who are interested, the media behind us, strong public advocates and cross-party support. So I'm very, very optimistic about getting some change in the area. Where we're up to, we've effectively got now a bill before the Parliament. It's been going through the committee phase. So any legislation goes through a committee phase, which means we take submissions on the legislation, we hear from people, we have public hearings, and we're going through that process at the moment. The committee is due to hand down its recommendations in the next, I think it's 3 weeks. So 3 weeks away from handing down our recommendations. And once we do that, and I'm optimistic we're going to get a cross-party, that is a consensus report that effectively endorses the legislation. The next step is to have that bill debated in the federal parliament and to have it voted on. And it's very rare that you get a bill that's being drafted by independent members of parliament, minor parties and so on that becomes law, but it's happened before and we think we've got a very good chance of getting this over the line sometime this year. Once that happens, we then have a medicinal cannabis industry and we have a medicinal cannabis treatment available to people right across the country, and that's effectively what this legislation's all about. I might leave it there because I'm really keen to have an interactive session. I'm quite happy to take questions on it. I suspect some of you will have some questions about how the legislation might work. And so why don't we start with some questions?
How much do you think the licence will cost?
So the question was how much would a licence cost?
Yeah.
Again, I'm very reluctant for for those of us as politicians who have drafted this bit of legislation to start making decisions about those sorts of details, I reckon that's the job of the regulator. So once we set the regulator up, and that's going to be a very important body, and having the right people on that with the right level of expertise and knowledge, they're the sort of decisions that would be made by a regulator. I mean, it's fair to say we've been very clear. I think the only way we're going to get this over the line is if we have a very, very clear dividing line between the issue of medicinal cannabis and recreational cannabis. So, as somebody who wants to see drug law reform across a range of areas, I think someone made the point earlier, our American guest, that in America the experience was medicinal cannabis. People got to see that as an effective treatment. They got to see that in terms of side effects, some of the concerns that they had were allayed, and the result was that the issue of recreational cannabis was able to be discussed in a different context. My focus is purely on the medicinal cannabis debate at the moment. I think it's potentially very dangerous to start introducing the issue of recreational use right now, because what we do by doing that is we have cross-party support for this. It's a very pragmatic decision on my behalf. We have got cross-party support for a piece of legislation that I have to say, even a year ago, I thought would have been impossible, absolutely impossible. So we've got that now, and I don't want to do anything that's going to jeopardise that. If we can get that over the line, then people can have a discussion about recreational use and what that might look like, what a regulated market might look like. But I want to keep those two debates very separate, and that's the focus of the legislation.
Just about your story about the TGA, mine's a bit different, and it might be worth some research going into this, because I have Parkinson's disease, and I wrote to the TGA in 2010 seeking an exemption from the banning of Sativex, a cannabis product from GW in Surrey, England. And after, I put the proposal to them and they knocked it back, so I appealed against that and they agreed to it. And I was just an individual. I didn't pay any $250,000. It took 9 months and several Commonwealth departments, but I think it might be worth exploring.
Well, I think there's two issues there. One is the drug was already had already been through the TGA process, so it had been listed. What you were seeking for is an exemption for the conditions under which it was listed. So that's separate from having a drug listed right from the start, which is what we're talking about here. So people have talked about the special exemption scheme, but I think what we need to do is we've got to make the medicinal cannabis available to people as a drug in and of its own right for its own list of indications. I think when we start talking about special exemptions for existing indications, we're automatically limiting the use of that drug, in this case Sativex, to a very, very small number of people, because the special exemption scheme really is just for individual cases. But I take your point. There are ways around it.
Yeah. Hi. One of the things that I would suggest that might be added is that you require medical schools to teach about the endocannabinoid system. Hopefully they will get into cannabis, but I mean, our feeling is, and I was with a number of physicians that put together what we call the American Academy of Cannabinoid Medicine. We're trying to marginalize those doctors that are practicing minimalist medicine. And what we'd like to see is all of the primary care doctors make recommendations to the patients, and rather than make people jump through another hoop. That doesn't happen that often. So what we're saying, look, if you have a physician that is basically making a lot of recommendations, they should have some special training. And that's something else that you might put in there. I'd be glad to talk to you about that afterwards. But I really think the endocannabinoid system thing, getting this into the medical schools, is a no-brainer, and I'm wondering what you think the prospects are of that.
I agree, and I think one of the lessons we've learnt is that if we introduce a medicinal cannabis scheme where doctors are pivotal to ensuring that it gets into the hands of people who needs it, then they've got to be trained in the use of medicinal cannabis, the indications, the pharmacology and so on. I can tell you from my own experience, I knew bugger all about cannabis except for the sort of this occasional paper that gets published every now and then linking the association between chronic use and potential for psychosis. That's the only, as a medical student, that really was the only context in which I learnt about medicinal cannabis. And it's true of most doctors right now. Most doctors don't know about it. They don't understand how it works, its uses, and the huge potential that exists for it as a drug. I think it's also fair to say, and some people won't like me saying this, there are probably claims made about its effectiveness for conditions where there's very little evidence. So we've got to be careful about making extravagant claims where we claim it does all sorts of things for all sorts of conditions, because what that does is it weakens our claims for those legitimate conditions where we know it works, where we know it's effective. Yes, I know, I thought I'd get a few of those. But no, as I said, I think, and the medical community has been a barrier here. They've been a barrier in terms of the response from groups like the AMA. I have to say they're softening a bit. I think as we've seen the experience in other jurisdictions where there has been support from medical groups, where the evidence now I think is starting to firm up in a range of for a range of conditions. The medical community is starting to come on board, but there's a hell of a long way to go. There's a hell of a long way to go.
One other point is somehow there seems to be, everybody agrees that there should be more research, not necessarily before you change the laws, but more research to take a look at some of these extravagant claims, some of which we have strong anecdotal evidence might be true. What are the prospects for funding research through your normal research channels in regards to cannabis and cannabinoids?
I think they're improving. They're improving now that, and one of the big hurdles is to, one of the things I've learned through the process is it's almost impossible to be able to do research when you can't get the drug into the country, you don't know what you're getting. There are so many regulatory hurdles to have to jump through to do it. So it's chicken and egg stuff. We can't get the drug in because it's illegal. We can't demonstrate its effectiveness for a lot of conditions for which, as you say, there's very strong, very good case studies for a number of conditions. So we've got to change the law to be able to do that first. And that's why I suppose the trials that are going on at a state level, look, I'm never going to say more research is a bad thing, but let's not let that be the hurdle to getting a change to the law. Let's not let more research be a barrier to providing it to those people for conditions which we know it works. And let's make sure that when we do get the law change, we make it easier for the research to be done so that we can demonstrate where it works and where it doesn't.
Hey, I've read a little bit on the Single Convention on Narcotic Drugs 1961, which I believe is the single convention that banned drugs internationally. It goes on in the preamble to state that these drugs should be provided for the relief of pain and suffering. So you had it involved a regulatory body for opiates, and all we're seeing really is opiates being regulated, but it doesn't state just opiates in the preamble, so I feel like it is left open that it should be, even according to the convention, available for the relief of pain and suffering.
That's right. There is absolutely an exception for medicinal use. And for medical and scientific purposes, both cannabis and opioids are absolutely legitimate. So there's the single convention is often used as an excuse for inaction. The real reason that we haven't got anywhere is ignorance on behalf of policymakers, I think the medical community. I've heard arguments that, particularly when it comes to opiates, that there's concern from some parts of the pharmaceutical industry about having a new entrant into the market that competes against opiates. I mean, we saw, it's emerging evidence, it's not definitive yet, but there's very promising evidence that where medicinal cannabis has been introduced in some states within the US, there's been a significant reduction in opiate overdose deaths. So, you know, we're seeing more people OD now from prescription opiates than from heroin. Many people are using prescription opiates for chronic pain. We know that where medicinal cannabis has been used and where there's been a substitution effect, less people are overdosing. So, I mean, I'm not sure how much of a factor the pharmaceutical industry's been in this space in terms of being an obstacle to reform. But the single convention doesn't, you know, when we're talking about medicinal cannabis, there is absolutely no reason under the convention that what we can do, there's nothing stopping it. When you talk recreational, that's a separate issue. But hey, the states, no, just in terms of the convention, but the states have decided that they're going to ignore it anyway, as the United States in allowing in the 2 states where it's now legal. So, I mean, you know, if America can do it.
Richard, thank you for your talk. I think the question of medicinal cannabis raises 2 main questions. The first one is the weather question, and we've more or less nationally decided, I think we're on the way to deciding yes to that. And we're now really more and more turning our mind to the how question. And I very much agree with you that on the weather question, whether we should or shouldn't use medicinal cannabis, the medicinal and the recreational use of cannabis are 2 separate issues and should be kept apart. But the more you think about the how question, and the closer we get to implementation, the more important it is to consider those together, because we can't really consider the question of providing medicinal cannabis properly and ignore the fact that 10% of the country uses recreational cannabis. And the reason for that is we're likely to start off with any scheme that we do start off is likely to be pretty restrictive. That's how we usually start things, and usually they get liberalised down the track. The more restrictive the medicinal cannabis system is, the more the people who want to use it and can't use it because it's too restricted will use unregulated black market cannabis. And from my perspective, that's not a good thing in terms of medicine. And the more liberal the system is, the more people will use a regulated cannabis. From my perspective as a medicine, that's a good thing. I'd appreciate your comments.
So I agree. I agree that, and as I said, I think I've made a very pragmatic decision that those 2 things must be kept separate if we're to get medicinal cannabis over the line and to change the law around medicinal cannabis. You're right that there's always a tension between how tightly it's regulated, how restrictive we're going to be in terms of the conditions that allow people to access it. What that means is that people who need it might not get it. Ultimately, what we do with opiates is accept that some people, there will be some level of diversion. I mean, we know that happens with opiates. We do our best to minimise it, and we accept that that the consequence of not providing opiates to people to avoid that diversion is that people don't get access to effective pain relief, and we're not prepared to accept it for opiates. So my argument would be, why would we make the law any different when it comes to medicinal cannabis? We're going to accept, yes, in some instances there may be some diversion. It occurs for all medicines where people are not using it for the purpose for which it's prescribed, but ultimately, if we're going to do the greatest good in terms of prescribing this drug, then we need to make sure that people who need it can get it. As I said, I think at the moment the 2 issues for me are separate, and I think that's really important if we're going to get this over the line, that we keep that line very clear.
Just last question over to you, Richard.
Thanks, Richard. Good to see you here in Nimbin, and welcome to the Mardi Gras, where recreational cannabis and medicinal cannabis come from the same bag.
Yep.
And I'd like to know how you define the difference between medicinal cannabis and can you understand the recreational therapy banner on the side, how to reduce stress and relieve tension is a healthy thing to do.
So let me answer the question this way, right? I got into Parliament because I wanted to achieve things and change the law around in this area, right? That's why I'm up here, because I think the way we approach not just this issue but all illicit drugs is a huge problem, and we're creating a lot more harm than we're preventing. So that's why I'm doing the job. The reason I've approached this issue in this way is because, in my judgment, it's the only way we're going to change the law. So we can have a debate about medicinal cannabis, recreational cannabis, the use of recreational cannabis, and how that bleeds into medicinal. But me in the Parliament with a strong, desire to want to change the law in this area, I've had to make a decision about the best way to do it. A pragmatic decision. It's absolutely a pragmatic decision, and my view is that this is the way to do it, right? This is the way we're going to get a change to the law in the federal Parliament. Now, you want to have a private discussion with me about all that stuff, I'm more than happy to talk to you about it, about my own private views. But in terms of actually getting, you've got to remember, we're talking about getting Tony Abbott to support this legislation. Don't ever forget that. Now, I reckon I deserve a medal if I can get him to change his, and it's not just Tony Abbott, it's Christopher Pyne, it's George Brandis, it's Erica Betts, it's the whole lot of them, And so my job, I can stand up here and say everybody should be able to, get the stuff whenever they want, but that's not going to achieve anything in Canberra. So if I have to be very clear and deliberate about what I'm trying to achieve, and that's the decision I've made. It's got to be bipartisan because, me standing up and grandstanding and saying this stuff, you guys will all say, yeah, fantastic, we love you, and nothing changes, right? So this is the reason I've done it in the way that I've done it. And if you had asked me a year ago about whether I had any chance of being here telling you this story and where we've got to and the potential to actually change the law this year under this government, I would have said you were dreaming. So anyway, that's how I'd answer that question.
Richard, thank you so much.
Good on you. Thanks.